How is it that you kind of fell into this?
Yes, this all started, Do No Harm, the organization that I helped found back in April of 2022. This all started in my role as the Associate Dean for Curriculum in Penn's Medical School. I had a career as an academic physician. I had done research, and I spent the last 13 years of my career there as running the medical school curriculum and meeting with the students and developing courses and making sure that they were learning what they should be learning. I thought we had a pretty good medical school. It was highly ranked, #2 in the country, behind Johns Hopkins or Harvard. Everybody, there was sort of musical chairs about which was the top few medical schools in the country. I thought we had an innovative curriculum, but a new vice dean for medical education came in. The one who I had worked with for many years retired from her post, and a new one came in, and she said, your curriculum is way out of date, and we need to be teaching the students to understand community issues. They need to understand social justice issues. They need to have a very, very different orientation than you have. There's too much science in the curriculum. She actually made that statement to me. At that point, I became very concerned because to me, the purpose of the medical school was to teach them to take care of sick people. It wasn't to cure the community. That's an important job. It's just not the job of the practicing physician. It's public health workers' jobs and politicians' jobs. Physicians need to really focus on caring for people, preventing illness, but also treating illness when they find it. I was kind of the heterodox person in the group. I was eventually forced out. And then one day I saw that an article in the Wall Street Journal that there was 40 medical schools had courses in climate change. And I became more aware that these social issues were being presented in medical schools around the country through her forcing me to interact with other medical schools around the country. And I wrote a letter to the editor of the Wall Street Journal, and the editor said, I don't know about this article, but I pointed out there was such an article, and he said, why don't you write an op-ed because you're an insider, really, and you know what's going on there. And I wrote this op-ed. It was called, by the Wall Street Journal, Take 2 Aspirins and Call Me by My Pronouns. Now, the article had nothing to do with gender issues at that point. It had to do with the fact that I thought the medical school curriculum had not become rigorous enough and that there was too much time spent on these social issues to the harm of learning about surgical issues, medical issues, and so on. There was a huge uproar over this. Medical Twitter, there's something called Med Twitter, it went crazy. And it said that, I didn't know what I was talking about, and these social issues were what drove healthcare. The school then denounced me, and then the Wall Street Journal wrote an editorial about my op-ed saying, I guess he was right, because the outpouring of criticism suggested that I really had hit a nerve. So at that point, then I went on to write a book about this because I was really annoyed about all this. With the same title, yeah. I didn't like the first title. It wasn't my title. It had nothing to do with gender at that point. But the Wall Street Journal gets to write the title to the op-eds, and that's what they used. And I think actually the title was so provocative that it was part of the reason there was such a response to it. But then the question was, what can we do about these issues? And should I just sit back? And I had the opportunity through some friends and some philanthropists that were interested in some of these issues to start an organization, Do No Harm, that would sort of fight back against some of this and point out how the curriculum in medical school had deteriorated and point out how identity politics were starting to produce real harm in healthcare. And we can talk about some examples of that. I must say, many of our donors said to me, what about this gender stuff? Why are children being put through this? And I frankly, like many physicians, I wasn't really that aware of what was going on. So that led us to look into the issue, and it became quite clear that there was a great harmony between the issues about DEI and identity politics in healthcare. This was another example of identity politics. These children were put into this category of trans kids, whether or not they had individual characteristics that suggested that their treatment ought to be very different than getting put on puberty blockers or sex-changing hormones. But they were put in this group. And it became quite clear that there needed to be sort of this legislative effort that we talked about earlier in this way, because there was just no way to control the whole process unless there were laws that were going to stop it. I'm very much against governmental laws intervening in healthcare and the way healthcare is practiced, but sometimes you have to step up when you find that there really are problems, and the problems are not being dealt with by the medical community, but they're just going on. And we have, unfortunately, over the years, many examples of the medical community adopting procedures and practices that turn out to be terrible. The great example of this is lobotomies for children that had psychological problems. A man won the Nobel Prize in medicine for lobotomies, and it turned out to be a catastrophe. And there are many other examples like this. Marty McCary, who's a well-known physician at Johns Hopkins, just written a book where he goes through many examples. The book is called Blind Spot, about how physicians have a blind spot about many issues, and he goes through many examples of medical conditions that have been really handled very poorly by the medical establishment and need to be treated, and have been treated, very differently. Do No Harm started, and we've had this tripartite approach to things. One has been the legislative one we talked about. We've tried to inform the public. I've been in interviews like this with some leading organizations. And finally, we've instituted a bunch of lawsuits, typically in the area of identity politics, where organizations, medical schools, and even companies have programs that excluded white and Asian students from participating, for example, in the description of the program. These are frankly illegal. They go against civil rights laws. They go against the 14th Amendment. And so we've instituted lawsuits, and we have 11 lawsuits now and 3 others pending, and we can describe some of the details of those. And we've sent about 150 letters to the Office of Civil Rights because of programs in various medical schools. If you send letters to the Office of Civil Rights, they will do, in the Department of Education, they will do investigations even if you don't have standing. The lawsuits that we filed, our members, it's a membership organization, we have 15,000 members, and our members, if they would want to apply to such a program and are excluded, it conveys to us to be able to support them and sue on their behalf organizations that have been engaged in practices. We've sued Pfizer, had an employment program that excluded whites and Asians from a very rich program of mentoring and employment and supporting further education. And again, in the program description, whites and Asians should not apply.
So I understand that Do No Harm actually has a number of reports that are going to be coming out in the not too distant future, like new developments, new research. If you could kind of let me know what you're working on.
Again, going back to this issue of the medical societies, the way medicine in the United States is practiced, yes, you go to medical school and you learn, you go through a residency program, but then the professional education that goes on really derives from professional societies like the American Academy of Pediatrics, like the American College of Physicians. They provide continuing medical education and all. And so they really are influential in each of the fields in which they have their specific subject material. What we've done recently is to do a study to look at how often they've strayed into social issues and political issues. How much of their efforts are devoted in their ways? And there's a report coming out to show that this is very, very extensive. They've adopted the diversity, equity, and inclusion issue. They've pushed very hard for their idea of how social determinants of health influence health, again, despite no real evidence and no real data to understand how living in a neighborhood that's violent, for example, leads to particular medical problems. No one understands what the link is there, how one could even begin to understand that and deconstruct it. And so we're going to be able to report to the public how these organizations are so invested in all of these social issues to the point where it detracts from their main purpose, which ought to be to improve the health of the American people. The American Society of Nephrology should spend all of its efforts, all of its time, all of its money on improving kidney health in the United States, and not on arguing for treating one group of people differently than another group of people, as they've done with these formulas for understanding kidney function. So we're going to be presenting that report. Another important report that we have written about in the past, I think, has been the main argument against undermining the meritocratic basis for admission to medical school. And this is, I think, a really important issue for the public. There are 2 applicants for every spot in medical school in the United States. And of course, everyone's aware of the fact that it's very hard to get an appointment with a physician. We really have a deficit of physicians in this country. The reason for that is complicated, and we rely to a great extent on foreign-trained doctors in the United States as well. But to get into medical school is really quite difficult. And unfortunately, the idea has been that we should take a certain number of minority individuals, particularly black students, into medical school because of the idea, the theory, that black patients need black doctors to have optimum health outcomes. We've issued a report on this in the past. In fact, there's a huge medical literature on this. There are over 60 studies of this question. Most of the studies involve how well do patients communicate with their physicians. They may do studies like record patient interviews with their doctors and then assess them afterwards. And the interesting thing is that that there have been systematic reviews of the studies that have been done. There are 5 systematic reviews of this question. Is there a benefit to concordance between patients and physicians based on race? And the answer is no. 4 of the studies absolutely find no benefit whatsoever. 1 study does find a benefit, but it excludes a lot of the studies that found no benefit. So it was an incomplete study itself. And one example of this is the question of, do black patients communicate better with black physicians than with white physicians? In one particular study, there were 8 examples where black patients communicated better with black doctors. There were 12 examples where black patients communicated worse with black doctors. And there were 80 examples in the various studies to show that it made no difference. And this is what you find over and over again. There just is no evidence that this is true. And when you sort of think about it, why should it be true? What you really want is the best doctor. And the patients want the best doctor. They don't want somebody that looks like themselves. And there are studies that have shown this. When black patients are given the opportunity to pick a doctor based on just a photograph, which one would you like? They don't pick the black doctor over the white doctor. There's no difference between their choices. And when studies have been done where there are real surveys done of black patients asking them this question, do you want the best doctor? Do you want a doctor that looks like you? They always opt in over 80% of the time for the best doctor. And yet, this has become the rationale for schools like the University of Toronto. 75% of the students in the medical school were going to be based on identity politics and weren't going to be based on merit. Insane.